syndrome. Another expression we give to this is interstitial cystitis. So if an individual is diagnosed with bladder pain syndrome or interstitial cystitis, they are the same word. Now you see, this bladder pain syndrome may mimic the infection or bacterial infection. Normally doctors in the hospital may confuse bladder pain syndrome or interstitial cystitis with bacterial infection because the symptoms may just be very similar. But remember that don't be taking antibiotics often because it damages the kidneys and it also reduces your immune system. So remember that. But what is bladder pain syndrome? How do we define it to distinguish that from bacterial infection here? Normally, you see, when somebody got a bladder pain infection or a bladder pain syndrome, it is the inflammation of the wall of the bladder. Every organ got a wall, so the wall is inflamed or is irritated, and normally if care is not taken, it could cause permanent scarring, which can reduce the capacity of the bladder. But apart from that, the pain that you feel normally in the bladder area or in the lower abdomen, for the next 6 weeks, the person may experience frequent urination. So if you have a pain or that sort of pressure buildup in your bladder area or the lower abdomen, and you have a frequent urination for about 6 weeks, you remember that it is bladder pain syndrome. It is not bacteria infection at all. And don't let any doctor give you antibiotics. Especially, research has shown that women are at a higher risk because, of the fact that women may have bacterial infections often because of the closeness of the anus and the vagina. So women normally have infections easily. All right. Now, what are the key symptoms here? There are 3 key symptoms of bladder pain syndrome. The first symptom is the pain. What sort of pain? Let's break it down here. This is the pain that gets worse as the bladder fills up. Okay, so some patients feel pain in other areas as well, not only the bladder area. There are some individuals that may feel pain in the lower abdomen and then the lower back or the pelvic area. In some women may feel pain behind the vagina or inside the vagina. The man may also feel pain in their scrotum or the testicles, right? Sometimes behind or inside the testicles. And then another symptom is the frequency of urination. Normally, every individual, we shouldn't actually urinate more than 7 times a day. Now, if you urinate more than 7 times a day and you are also experiencing pain, now remember that it could be then bladder pain syndrome. Apart from the frequent urination is the urgency to pass urine. Normally, healthy bladder wouldn't give you any form of urgency. In fact, healthy bladder will help you contain the urine for some time. Even sometimes when you feel the urine, it could switch off if you don't urinate. And after an hour or 2, it will return. That's how healthy bladder works. But in the bladder pain syndrome, it doesn't work like that. You feel the urine, you have the urgency to pass urine. If you are not careful, you just do it on yourself. Now, this is some of the key symptoms that we should take note of. The 3 key symptoms: the pain, the frequency, and the urgency. All right. And then among men may feel also pain. They may experience painful orgasm or pain the next day after sexual intercourse with their partners or wife. The women may also have pain during sexual intercourse. In fact, they may have pain that is so unpleasant that they may not want to have sex with their partners or husband anymore because of that. They may try to avoid that. This leads us to the complications. If you have bladder pain syndrome, it can bring a lot of complications to your life. It can reduce the capacity of your bladder because it causes scarring in the bladder wall and can cause permanent reduced capacity, which can give you long-term problems. Another thing is that it lowers your quality of life. Why? Because frequency of urination can interfere with your everyday activities, with your social activities, with your work life, or with your other activities of our daily life can be affected. So quality of life can naturally be reduced. It will definitely, as I was saying, reduce that sexual intimacy. It can bring that problem as well, because the woman is having pain, especially women, and the men also having pain during orgasm or after the sexual the following day. That can discourage them getting into it. And if it goes on and on, this can definitely lead to what? It can lead to relationship problem. There's also another complication is emotional troubles. Normally because you can't sleep well at night, it can affect you. It can easily make you feel stressed out the following day. Can cause emotional stress, which can lead to depression if it goes on and on for a long time. But remember, if your sleep is disturbed for a prolonged period of time, it can affect other things too. Your immune system will go down. It affects your heart. It affects your brain because your brain shrinks more quickly. It can lead to metabolic problems like diabetes, okay, and some other forms of more difficult problems like conditions like the cancer. Somebody may ask, doctor, what is the cause? Scientists don't even know, but they presume, it's a presumption that maybe some toxins in the urine may cause the irritation, or immune system may affect the bladder. That's why it's important to have stable immune system. All right. So these are some sort of presumption. It is important that you also have good digestive system. If a person got constipatory problems or irritable bowel syndrome, it's also a promoter. It's likely that a person may have bladder pain syndrome or interstitial cystitis. Today we've learned a lot. You now have a picture of bladder pain syndrome. You can be helpful to someone or yourself. Maybe you're listening to me, you may have this problem or different problem, a chronic disease, and maybe you are not. Please get this number and call. Share the number, be a blessing to somebody, and your life will never be the same. A phone call away. Remember, chronic problems cannot be solved with modern medicine. All right, only natural medicine. Give me a call now. This is a WhatsApp number. Calling outside the UK is +44 738 464 7300. You call it within the UK is 0738 464 7300. If you want to learn more, do more learning, have more knowledge, visit me on my YouTube channel. Put in Dr. James Natural Link. Dr. James Natural Link. When you go there, subscribe so you don't miss any of the future program. Also click the like button, share the presentations there, be a blessing to somebody. I'm so grateful for the fact that you've been with